So how close to your home is COVID-19 now? More confirmed cases, as we've reported, are coming in every day. More people are trying to be tested, getting tested. That does have an impact on what's going on in Evansville. What should you do if you think you might need a test? Eyewitness News' Miranda Meister is here with those answers.
I spoke with local leaders in healthcare about steps people should take if they feel a test is necessary. But coming straight to a doctor's office is not recommended. There are procedures in place.
We don't know how much this will spread in our community. We presume that it is in our community, despite that we have negative tests.
When you have a cold or feel sick, during normal circumstances, the advice would be go to the doctor. But when it comes to the coronavirus, healthcare professionals are asking people to wait before they walk in.
It is very similar to having a flu test done, where it's a nasal swab.
But the process of getting results is much different.
Although the flu test and coronavirus test are obtained the same way, the coronavirus test does have to be sent out to other laboratories.
With that said, hospitals and the federal government are taking steps to make sure the potential for spread is decreased.
Today, we're also announcing a dramatic expansion of our Medicare telehealth services. Medicare patients can now visit any doctor by phone or video conference at no additional cost, including with commonly used services like FaceTime and Skype.
Calling your doctor first is one of the steps Deaconess Hospital has suggested for patients who are worried. So how do you know if you need to be tested?
So the answer is evolving every day, and the criteria for that test to be done today was different yesterday and will probably be changing even tomorrow.
If you have the symptoms of a cough, fever, or shortness of breath, contacting a medical professional by phone or online is recommended. He says this is suggested to make sure the supply of testing materials doesn't run out.
At this point, if we were to test every patient that may have a cough or fever, I think there would be a concern that we would run into a limit of the tests available. So that's part of why the criteria has been so limited.
Troy says contacting a hospital by phone first helps them protect their patients that might be in the hospital and staff. Now, how much will it cost to get the test? That depends on your health insurance. And how long will it take to get your results? It depends on what lab they're sent to. If the swab is sent to the state lab, it could be a day or two, but local labs might be up to 6 days. Miranda Meister, Eyewitness News.
Well, starting tomorrow, Deaconess says it plans to start offering drive-through coronavirus testing for people who have an order for testing.